Hi everyone, welcome back to PharmaExplora. Today we are going to discuss another interesting route of drug administration, that is subcutaneous route of drug administration. So I hope you can remember in our previous episodes we discussed the routes of drug administration. So there we divided those into three main categories: the enteral route, parenteral route, and the other specialized routes of drug administration. When it comes to parenteral route of drug administration, we define the parenteral route of drug administration involves administering the drug directly into the systemic circulation. There we further divided this into intravascular, intramuscular, and subcutaneous routes of drug administration. And based on the place where we administering the uh, drug, we further divided intravascular into intravenous and the arterial route of drug administration. And in our previous last two episodes, we discussed the most common intravenous route of drug administration as well as the fascinating intramuscular route of drug administration. So, if you miss those videos, if you want to have a quick refresher, I have put the link down below so you can go through those as well. However, today we are going to discuss about the subcutaneous route of drug administration. Okay, now let's think like this. What if we need a parenteral injection that completely avoids the high risk associated with intravenous or the IV route of drug administration and still provides remarkably the constant, slow, as well as the sustained therapeutic effect? And what if we need a safe, simple, predictable route of drug administration that patients can easily self-administer their medications at their home without having the technical challenge of locating the vein or the deep muscle? So, to answer that, pharmaceutical scientists have developed this subcutaneous route of drug administration. So, without further delay, let's start today's discussion about subcutaneous route of drug administration. Okay, now we are going to discuss what is subcutaneous route of drug administration. When we take the cross section of our skin, you can see the outermost layer is epidermis. The outermost layer is epidermis. And just beneath the epidermis, you will find the dermis. You will find dermis. And below the dermis, you will find this subcutaneous tissue. Just below the subcutaneous tissue, you will find the muscle. So when you take the cross section of our skin, the outermost layer is epidermis. Just beneath the epidermis, you will find the dermis. And below the dermis, you will find the subcutaneous tissue, which is relevant for our today's discussion. And below the subcutaneous tissue, you will find the muscle. So, when we administer drugs subcutaneously, what we do? We inject the drug solution into the layer of the fatty connective tissue just beneath the dermis of the skin. So, when you giving a drug in subcutaneous route of administration, you inject the drug solution into the layer of fatty connective tissue sitting directly beneath the dermis of the skin. So that tissue is known as the subcutaneous tissue. So when it comes to the subcutaneous tissue, unlike our skeletal muscle or major veins, this underlying adipose fat layer has much lower density of large blood vessels. So this is very important. So when it comes to the subcutaneous route of drug administration, that means we injecting the drug solution into the fatty connective tissue layer known as the subcutaneous, locating just beneath the dermis of the skin. But when it comes to the subcutaneous tissue, unlike the skeletal muscle or the major veins, this underlying adipose fat layer has much lower density of large blood vessels. Lower density of large blood vessels. Therefore, this unique anatomy provide or facilitate once drug fluid is deposited here, it cannot immediately rush into the systemic circulation. Because of this unique anatomy, once drug fluid is deposited here, it cannot immediately rush into the systemic circulation. Instead, it forms a localized pool of the drug solution that find its way into the bloodstream gradually. So instead of rushing into the systemic circulation, it forms a localized pool of drug solution which find its way into the bloodstream gradually. So basically, this is what subcutaneous route of drug administration is. Okay, now this subcutaneous route of drug administration using a fundamental transport process called simple diffusion. So the subcutaneous route of drug administration using this fundamental transport process called simple diffusion. I'm sure you have heard about this term simple diffusion. The simple diffusion is the passive movement of the substances across a cell membrane from its high concentration to a lower concentration without needing a cellular energy. So passive diffusion, the simple diffusion is the passive movement of substances from its high concentration to a lower concentration through a cell membrane without using the cellular energy. So the drug molecules in the subcutaneous layer naturally moves the surrounding tissues using the simple diffusion. Why? We inject the drug into the subcutaneous layer, so there is a high concentration of the drug molecules at the site of injection. So drug molecules in the subcutaneous layer naturally moves into the surrounding tissues using this simple diffusion. And these drug molecules slowly trickles down through the fatty matrix until it crosses the delicate or very thin the endothelial walls of the local capillaries. So, the drug molecules in the subcutaneous layer where the drug concentration is high naturally moves into the surrounding tissues, and these drug molecules slowly trickles down through this fatty matrix until it crosses the delicate or very thin endothelial walls of the local capillaries. That's how these drug molecules enter into the systemic circulation. So you can see this body fat act as a physical barrier for rapid transit. So this body fat act as a physical barrier to rapid transit of these drug molecules into the systemic circulation. So that is why the subcutaneous routes, the drugs given through subcutaneous route, the absorption is significantly lower. So the absorption is significantly lower when you give drugs subcutaneous. So pharmaceutical scientists have converted this nature into a exceptional advantage in pharmaceutical formulations. Okay, now it's very clear to us this subcutaneous route of drug administration bypasses direct entry of drug into the blood vessel. Therefore, it acts as a brilliant safety mechanism. So, this subcutaneous route of drug administration bypasses the direct entry into the blood vessel. Therefore, it acts as a brilliant safety mechanism. So, this subcutaneous route of drug administration minimizes two major vascular risks associated with IV route or the intravenous route. Those are hemolysis and the thrombosis. So, hemolysis is the destruction of red blood cells, and the thrombosis is dangerous formation of blood clots within the blood vessel. So, hemolysis is the destruction of red blood cells, and the thrombosis is dangerous formation of blood clots within the blood vessel. So, the subcutaneous route of administration minimizes these two vascular risks associated with intravenous route. So, these two complications can happen during IV push. So, these two complications happen during intravenous push if a drug concentration spikes too quickly. So, these two complications avoided by the subcutaneous route of drug administration. Instead, it provides constant, slow, highly sustained therapeutic effect over extended period of time. So, instead of the rushing into the blood vessels, this subcutaneous route of administration provides constant, slow, highly sustained therapeutic effect over longer period of time. Okay, now we are coming to the most critical part of our discussion. Because of the stationary nature of the drug pool developed by this subcutaneous route of drug administration, introduce a massive clinical restriction as well. Because of the stationary nature of the drug pool in the subcutaneous tissue, this route introduces massive clinical restriction as well. That is, subcutaneous route must never be used with the drugs that can cause tissue irritation. So, this is very important to remember. Because of the stationary nature of the drug pool, subcutaneous route introduces a massive clinical restriction. That is, subcutaneous route must never be used with drugs that can cause tissue irritation. If you can recall our discussion about the intravenous route, we discussed that intravenous route is highly advantageous over irritating chemicals, drugs which are irritating chemicals. Why? Because of the high volume of drug moving through the vein can instantaneously dilute the irritant chemicals. If you can recall the IV route, we discussed it is highly advantageous over the irritating chemicals, drugs as irritating chemicals. Why? Because of the high volume of blood moving through the vein can immediately dilute the irritant chemicals. But when it comes to the subcutaneous route, we know the drug stays in the fat layer of the subcutaneous tissue for longer period. The drug stay in the subcutaneous tissue fat layer for a prolonged period. So, if you inject irritating chemical through subcutaneous route, what will happen? Drug will trap in one spot. So the drug will trap in one spot and it can cause severe localized pain. It can cause severe localized pain. The drug stay in the when you give the subcutaneous injection, we know the drug will stay in the fat layer for prolonged period. if you inject irritating chemical, what will happen? Drug will trap in one spot and it will cause a severe localized pain. And even worse, it can trigger tissue necrosis. That means death of the cells. So trigger necrosis of surrounding skin and tissues as well. So that is also very bad effect if you administer irritating chemical through subcutaneous route. Therefore, it is a must. You have to keep in mind subcutaneous route must never be used with the drugs that can cause the tissue irritation. Okay, now we are coming to the most interesting part of our discussion. Why? Uh, Now we are going to discuss about the real world clinical impact of this subcutaneous route of drug administration. Now, because of its the subcutaneous route's slow, predictable and non-volatile profile, this has become the ultimate route of drug administration when it comes to the long-term outpatient care as well as the chronic disease management. Because of its slow, predictable, non-volatile profile, it has become the ultimate route of drug administration in long-term patient care as well as chronic disease management. Now we are going to take two real-world examples, two drug examples and discuss how. Our first one is very famous insulin. Our first example is famous insulin. Now we know when it comes to the managing diabetes patients, maintaining steady, continuous control over blood sugar is daily necessity. When it comes to managing the diabetes patients or the diabetic individuals, the maintaining the steady, continuous levels of blood sugar is daily necessity. So, we know, we have discussed this earlier as well, insulin is a peptide hormone. So, if you take insulin as a pill through your mouth, once you swallow and it travels down to your stomach, in the harsh environment of the stomach will destroy this insulin completely. So insulin is subjected to destroy by the acidic environment of the stomach as well as the digestive enzyme. Therefore, the oral route is not an option for insulin. So that is why pharmaceutical scientists developed the subcutaneous route of drug administration for this essential medicine. So, once you give the insulin through subcutaneous route, it allows patient can easily and painlessly administer the medication daily at their home, and it will allow insulin to smoothly diffuse into the blood slowly and steadily. Thereby, it can control the blood sugar uh, throughout the day. So let me explain it again. Our first example is famous insulin. So when it comes to managing the diabetic patients, maintaining the steady, continuous control of blood sugar is daily necessity, daily requirement. But we know this insulin is a peptide hormone. So if you take insulin as a pill through your mouth and swallows, it goes through your stomach, or it travels down your the gastrointestinal tract, and once it reach to the stomach, um, uh, in the acidic environment and also in the presence of digestive enzymes, insulin is easily destroyed. So, oral pill is not an option. Therefore, pharmaceutical scientists developed this subcutaneous route um, for this insulin medicine or the essential insulin medicine. So, once you give the insulin subcutaneously, in one hand, this insulin can easily, painlessly administer patient by themselves at their home. And also, this insulin smoothly diffuse into the blood slowly, steadily throughout the day. Therefore, it will control the blood sugar throughout the day. So that is how this subcutaneous insulin supporting patients to manage their diabetic condition. And now we are going to discuss our second example. It is a critical one, the heparin. The heparin is a powerful anticoagulant, or in our day-to-day word we can say a blood thinner. So once you give heparin subcutaneously, this will allow steady, slow, highly predictable release of heparin into the bloodstream. Once you give heparin subcutaneously, it will allow steady, slow, highly predictable release of heparin into the bloodstream or the systemic circulation. This will allow to keep the patient protected against the blood clots as well as the drastically minimizing the risk of internal bleeding. If you give high amount of heparin suddenly, there may be a risk of the internal bleeding. But once you give the subcutaneous route heparin, what will happen? It steadily, slowly release the medicine. Therefore, it will keep the patient protected against the blood clots while drastically minimizing the risk of internal bleeding. Okay, so these are the two famous examples. Insulin and heparin are the two famous examples for subcutaneous route of drug administration. Okay, to wrap up, today we discussed about the subcutaneous route of drug administration. So we discussed what is subcutaneous route of drug administration, what is the mechanism behind that, and what are the special advantages and what are the special concerns or the disadvantages of this route. And also we discussed the real world examples of subcutaneous route of drug administration. If you have learned something from this video, just hit the like button and subscribe the PharmaExplora channel. So thank you very much for joining with PharmaExplora today and see you soon.